NACA, Dr. Yinka Falola Anumwa, Deputy Director, Head of Gender and Human Rights Unit at the National Agency for the Control of AIDS, NACA, joins us now from Abuja studios. Thank you for joining us on the program.
Thank you. Good evening, Millicent.
Good evening. Nigeria's commitment to ending the HIV epidemic in the country has never been in doubt, but surely in recent times, attention appears to have shifted to COVID-19. Now, is this the case in your view? And if it is, take us back to the beginning of the pandemic. How did HIV/AIDS patients fare?
Thank you very much. Yes, global attention is shifted and is moving towards more on COVID-19. But here in Nigeria, we continue to work with people living with HIV and to identify them and link them with care, particularly during the lockdown and between the commencement of the response to COVID-19 in Nigeria. And now, like my DG said, we have linked more people to care, more people living with HIV to care. And this is possible because we work collaboratively with all our partners. Even during the COVID-19 lockdown, we have community pharmacists who were working with us to continue to ensure people get their stock for care while at home, and we were working as essential workers. We also work collaboratively with Nigeria Center for Disease Control to use the experience we've gathered over the years in managing the last biggest epidemic before COVID-19, which is HIV/AIDS, to support the national response to the COVID-19. So within this period, we were able to provide the necessary care for people living with HIV, including palliative care. And we have our partners working with us over the years, specifically PEPFAR, the UN systems, and we have Global Fund, and to work with us to also use the experience we've gathered over the years to support the COVID-19 response and also ensure that those living with HIV continue to get care. And like the DG said, Nigeria was identified as the most resilient country in all PEPFAR countries during the COVID-19 lockdown and the most difficult moments responding to HIV at the same time.
So on the issue of vaccines, which are currently ongoing now on COVID-19, are COVID-19 vaccines safe for persons with HIV/AIDS?
Yes, COVID-19 experience and science has shown us that COVID-19 actually is people with comorbidities, that is people who have other disease burden, like people living with people who are hypertensive, people who have diabetes, people who have immune compromised condition like HIV are more prone to contract the virus. And so we need to work more closely with them to ensure they maintain good health and they continue to get all their care and protect themselves from contracting the virus. But where they come down positive, of course, that will be double jeopardy because they already have condition they are managing. But in terms of vaccination, there has not been any documented case negative effect of vaccination on those living with HIV. So it's scientifically proven that it's good for them to be protected. In fact, they are one of the four sets of people who must get vaccinated.
Now, Doctor, in terms of the plans now and going forward in the pandemic, especially for the HIV-infected community, what are they and what will your messaging be on?
Yeah, the message that we've been taking around and working with them, over 1.9 million of them estimated to be living with HIV in Nigeria, and specifically the 1.7 million that have been enlisted in care the antiretroviral therapy, is that they have to keep to their medication and they have to protect themselves from, by doing all of the social protection, social non-pharmaceutical methods of protecting themselves from contracting HIV, from contracting COVID, and also get vaccinated. So we continue to take that message up. And again, we also had partners who supported us, that during the lockdown and even up to now, those of them who are very indigent, who have a negative economic impact of COVID-19, they get support. We provide skills for them. Over 10,000 of them, about 10,000 of them are getting some form of support from the program that NACA runs with United Nations, UNA specifically, and we continue to use that opportunity to give them information about COVID-19. We have trained their community mobilizers, who are people living with HIV themselves, who are skilled to share information about COVID-19, HIV, AIDS, and gender-based violence as they all interact and impact on each other. So the message continues, working closely with people living with HIV and all our partners across levels, up to community level in the country.
All right, we appreciate your time on the program. Thank you so much. Dr. Yinka Falola Anumua is the Deputy Director, Head of Gender and Human Rights Unit at NACA. Thank you for joining us.
Thank you.